Everybody having a good week? Today's Wednesday. We're getting there. Hi, everybody coming in. If you guys would put your names and your campuses in the chat, that would be fantastic. Would appreciate that. Pardon me. Still pretty cold here in Colorado. Gonna get more snow today. Okay, almost ready to get started. Just trying to get everybody in. How is everybody for a Wednesday? Okay. There's a few of you that need to turn your cameras on. I would appreciate that. Okay, I think we have most everybody here. I'll keep an eye for latecomers. So, week 8. We're in week 8. We're in the home stretch here. This is actually the last week of content, and we've got 8 topics to cover today. So my plan today is to go in and out of the book and my notes for these 8 topics. And then I have 3 case studies that I'd like to do. I'd like to do a case study with ethics, one with disaster management, and one with program management, which are 3 of the topics we're going to cover today. Hopefully you're prepared for class and these aren't unfamiliar topics to you. I don't know if you had a chance to look at the study guide. Anyway, so first things first, evaluations. I would appreciate it if you could complete your midterm evaluations that I believe were available to you last week. So if you filled them out, thank you. If you haven't, very helpful information for both me and the community program so that we can always be working to improve things to make it better for curriculum, better teaching strategies. We're wanting to make sure we meet your needs. Okay, so if you haven't had a chance, if you could fill that out, that'd be great. This week, exam 3 reviews are going on. I don't know if anybody's had a chance. I think there's only been 1 so far. And I don't have the recording for that yet. You guys have the schedule. Everybody has a schedule, right? Of when exam 3 reviews are. They were sent in week 1, and it was exam reviews for the whole term. Okay, so not only do you have week 3 in there, but you also have HESI. So hopefully you guys can maybe try and get to a live review. That would be fantastic. And then as I get recordings from the other professors, I will send them on to you, like I've done for exam 1 and exam 2. So hopefully you can get to those. Lots of students have scheduled tutoring with me. Some have already had the tutoring review session, tutoring, whatever you want to call it. And then I have several upcoming. So if you're wanting to review exam 1 or 2 or both, and you haven't reached out yet, it's not too late to reach out. Okay, so just email me. Every single time slot that I put out for this week got taken, and I've added probably 8 additional students. So lots of tutoring happening this week. And don't think of tutoring as a negative thing. Maybe say review. It's not it's fine to go for tutoring, go for review. That means you're wanting to help understand what concepts you might have missed. So don't be afraid to schedule time with me. I think it's beneficial. Students, I think, feel it's beneficial. So that's open. This weekend's announcement will give you kind of a roadmap for the rest of the term. So week 8, this is our last week with content. Next week, you take an exam, right? That's 9. And then week 10 are all HESI reviews. Okay, and you have the schedule. Okay, you're just required to attend 1 HESI review. It doesn't have to be for this class time. So know that in week 10. Okay, it doesn't have to be this particular class, but as long you have to let me know which one you've attended. And that's all in the announcement. I just want to give you a heads up. So look ahead to week 10 with all your other classes and all your clinicals or makeup clinicals. and make sure you can get to at least one class in week 10. And of course, week 11 is HESI. You've got your HESI review guide. As I've said before, please don't wait till 2 days before. Please don't wait till the end of week 10 to open that study guide. It's quite long. Well, it's 8 weeks worth of content. So it is going to be long, but please, start familiarizing yourself with it. Every concept in there should be familiar to you after today. So please be using that study guide. Okay. I think that was all of my announcements. Your group projects were absolutely fantastic. Fantastic. I graded those yesterday. Absolutely fantastic. Wonderful, wonderful job. Very proud of you guys. It sounds like most of the groups did very well with organizing and communicating and coming up with their final projects. So they were excellent. So wonderful, wonderful job. Great job. Does anybody have any questions before we cover this content? Nobody has any questions, huh? Do you guys have any other exams next week? Along with, no, next week is reviews. Yeah, so, oh, no. Next week
No, I
is
have 2
exam.
exams next
Do you
week.
guys have other exams next week?
Yes.
I think we talked about this with one student. I think I talked about this. So really time to put your time management skills in place, your organizational skills in place. It's going to get real busy the last 3 or 4 weeks here for everybody. Okay. Okay, any questions? I'm going to share my screen. We're going to jump to the book and just review quickly each chapter. I'm hoping you prepared. I sent you 8 different PowerPoints. I hope you at least know the topics we're going to be covering today. I'm going to review them briefly, and then we'll do the case studies. Okay. Okay. Let's start with ethics. Okay. Ethics is one of the foundations of our nursing profession, right? Why is ethics important in public and community health practice or for nursing practice? What is ethics? What is it all about?
Being basically almost politically correct in having a background of information about others and respecting that. Like sometimes at a workplace, it's not ethically correct to spend more than $10 on a gift for someone that works above you because it's considered like bribing. It's ethically incorrect to speak about like gender or religions in a workplace. Like that's more so where ethics stand.
Great. That's a great beginning. Who wants to add to Devin?
It's kind of like studying the morality of human being based on, especially in decision making in the critical care unit of healthcare.
Mhm.
Yeah,
Excellent.
it's right and wrong.
Yeah, absolutely. Anybody else? We're just not going to be faced with ethical dilemmas and ethical decision making in our professional careers, but we're faced with ethical decision making and ethical thinking in our whole lives, right? All areas of our lives, our family, our work environment.
So I think that means that it's not necessarily like right and wrong as much as it's like what's appropriate.
If you had 100 people doing something, what is the right thing to do? What would most people, reasonable people think would be the right decision. Right? Common sense. Okay, and we're going to face, has anybody work in an environment where they have had an ethical dilemma? Whether it's end of life, beginning of life, medical decision making. Has anybody had an ethical issue come up in their environment that you were involved with? Ethics is one of the core foundational principles of nursing. So it does play a huge, huge role. Right, and that's one of your objectives here, number 4. Describe how ethics is part of a core function of nursing. Can anybody answer that? Anybody dig into the chapter and find the answer to that objective? There's several ethics questions on your exam. Okay.
I think a big ethical question, especially nowadays, is like end of life care, especially when you get terminal patients who know that they're not going to get any better. And the question of whether or not ending their life is going to be something that is beneficial to them, or like the assisted euthanasias that you can do in certain areas of the world, because these patients are at their wits' end, have done all the treatment, know that they're terminal. They've had the conversation where you can either go to hospice and kind of get supportive palliative care, or just let them go. And that was like Kevorkian and all those, cases that were around in the 90s and early 2000s. And I grew up with all that being on the news everywhere. And whether or not that is ethically something that is okay to do, because you have that patient's permission, or whether that's illegal and unethical and going against your oath as a doctor and a nurse to do no harm.
Right. We'll talk about that in a minute when we talk about the principles. Excellent. Does anybody have anything to add what Olivia said?
So correct me if I'm wrong. So basically the ethical part of the nursing is you're basically the advocate to the patient while providing patient care, whether it's terminal, not terminal,
Correct.
everything in between. Okay.
Correct. And there are ethical principles. I'm just going to jump there. There's ethical principles. Okay, I'm on page 639. Okay, you need to know this. Ethical principles, right here, box 6.1. Let's review them, Karen, because this dictates our care. These are the principles. Okay, respect for autonomy. Without reading this, does anybody know what respect for autonomy is? Think about, what does the word autonomy mean?
Privacy.
Independence.
Independence. Right? Autonomy requires that individuals are permitted to participate, choose the actions they want. Right? Advance directives. Individuals be permitted to choose those actions and goals that fulfill their plans unless those choices result in harm to another person. Okay, you're going to have several questions about these ethical principles given scenarios, and you have to decide which ethical principles should we be using in our practice. So the respect for autonomy is the individual's right to choose and participate in their plan. You've probably all heard of non-malfeasance and beneficence. They're pretty common ethical principles. I don't know if you've discussed this in your other classes, right? Non-malfeasance requires that we do no harm. Okay? We know that it is impossible to avoid harm entirely, but this requires that we practice within the standards of our care, right? We practice within the scope of our practice, And the ultimate goal is to produce the least amount of harm. Okay, so do no harm, non-malfeasance, do no harm. Then beneficence requires that we do good. Okay, we know that we have limited time, place, talents in the amount that we can do good, but we have the general obligation to perform those actions and maintain or enhance dignity of the other people whenever those actions do not place an undue burden on healthcare providers. So do good. Okay, so we're guided by respect for autonomy, non-malfeasance, beneficence, and the last one is distributive justice. And that requires for there to be a fair distribution of benefits and burdens in society based on the needs and contributions of its members. Okay, this principle also requires that consistent with the dignity and worth of its members, within the limits imposed by the resources, we have to decide on who gets what. And the ultimate goal is that services and resources should be available to all. But we know that's not true, right? There's very limited resources in communities. Who gets what? Well, the principle of distributive justice says we do our best with the resources and limitations we have to make sure everybody has services available. But we do know that doesn't happen. And we do know that doesn't happen a lot. What would be some examples of distributive justice issues?
Maybe deciding who gets an organ transplant and taking into account not necessarily, I mean, you have to take into account the entire patient, whether or not they're like a mom and they have young kids, the severity of the disease, and you can't get a lung transplant if you are an ex-smoker and haven't been willing to give it up, and what lifestyle modifications and changes they're willing to make, and because there just aren't enough for everybody who needs one, and figuring out who gets to go on the top of the list and who's going to receive and who's not is definitely not a committee that I would want to be on.
Exactly. Exactly. Thank you, Olivia. Anybody else want to add to that? Organ transplant, huge issue with distributive justice. What about access to healthcare? Would that fall under this principle? Access? What if you're uninsured? What if you're underinsured? Is it going to be hard to apply the principle of distributive justice in your community practice? Which other give me an example of respect for autonomy. How would you be practicing with that ethical principle of autonomy? What would you be doing? You'd be asking the patient what their wishes are, right?
Right, and I think respect for it would be like having a DNR and something that you like personally don't agree with, but you know, still providing them with the documentation that they need to receive it.
So can you see how all these 4 ethical principles apply to our practice? This is the core foundation of our practice, these ethical principles. Okay. I want to go back up because I missed. Okay. Table 6.1. Let's talk about the steps of an ethical decision-making framework. What is the first thing that we need to do when we are making ethical decisions? The very first thing we have to do. Well, think of your ADPI. What's the very first thing we need?
Want to assess and identify the problem.
Exactly. You have to identify what the ethical issue or dilemma is. How are you going to be able to make sound ethical decisions if you can't identify what the issue is? And then if you read through the rest of table 6.1, it simply goes through the ADPI for ethical decision making. And I've said the whole term. Nursing process is applied in every chapter we've talked about. All these different topics, all these different concepts. We have to be able to apply the nursing process to ethical decision making. And these 7 steps go through your ADPI. So I do want you to read through those. Okay. How is, hang on. There are other kinds of ethics. I don't know. Let me make sure I cover this all for you guys. There's what we call virtue ethics. Okay, and I just briefly read through this section in the book. There are feminist virtue ethical theories, feminist ethical theories, care ethical theories. I just need you to have an idea of what each of those are, and it goes through each of them right here, starting on page 111. Care ethics, feminist ethics. What was the first one? Virtue. Okay, so just have a read of those 3 sections. Okay, you're going to get asked about a few of these and given a scenario and said, should we use our virtual ethical information, feminist? What do feminists think about ethics? Well, that's right here. Okay. They are feminist ethics is basically political and social structures of health. Okay, issues of equity. So have an idea of basically what feminist ethics are, care ethics, and virtue ethics. Okay, and then here's the other objective I wanted to cover. And I want you to make sure you read through this section, okay? The ethics are and the core functions of public health nursing. Okay, and the nice thing about this section is it goes through the ADPI. Okay, so you have your assessment. And your assessment, I'm sorry, core principles of public health nursing. There's 3 of them. Assessment, policy development, and assurance. This all starts on page 111. Okay, so policy development includes, as a public health nurse, we're developing policies that reflect the preferences and the goals of our community. Assurance, what's assurance? Making sure that the essential community health services are available. And then assessment is exactly what it says. Refers to collecting data on the population, monitoring it, making information available about the health of the community. Okay, so those are your 3 core functions of public health. Assessment, policy development, and assurance. And then have a look too, this is in your study guide, have a look at your Healthy People 2030 objectives related to access to healthcare. So in nursing, we have a code of ethics. Can somebody tell us what a code of ethics is? Really important about our code of ethics. What is it? It gives
It's
you
our standards that we have to follow.
ethical standards, code of ethics. There's a reason why ethics is in code of ethics. Okay, it's our non-negotiable ethical standards. It's also an expression of our of nursing's own understanding of what our commitment is to the community. Right, and the overarching statement about the nursing code of ethics, it's a statement of our ethical values, our obligations, our duties, and our professional ideals. Different areas of nursing have different code of ethics. So we're talking specifically here, public health nursing code of ethics. Okay. And here's your levels of prevention on page 115. Please review those. Let's just review it. Primary prevention with regard to ethics. Well, if we use our code of ethics for nurses to guide our nursing practice, right, hopefully we'll prevent any issues. Right, so simply using the code of ethics is a primary prevention, right? Secondary, early identification of issues, early intervention. So secondary, if you're unable to behave within the code of ethics, right? Maybe you speak in a way that is disrespectful to somebody. Okay, well, secondary would be you take steps to correct that. Right? It's a early identification of an issue. Right? You could apologize, explain to the patient you didn't mean to be culturally insensitive or use a negative tone of voice. So yes, something happened, but you're working towards correcting it. Whereas a tertiary, something has happened. Okay, you've treated a client or staff member in a way that's inconsistent with ethics practices. Maybe you need some retraining, re-education. Okay. Okay, that's all I want to cover about with ethics. Anybody have any questions? Like I said, several questions about ethics on the exam. So review what we just went through. Okay, culture. Culture of populations in the community. We've addressed culture several times. Okay, so let's have a look at some of the objectives. How does culture, let's just openly talk about the first objective. How does culture affect our nursing practice?
Really, it more so affects the client's beliefs because it changes the way that we approach the client based on their cultural belief.
Mm-hmm. You also had questions on cultural competence in exam 2. What if we are not culturally competent? What happens in our nursing practice? Can there be miscommunication, problems?
We cannot render the proper care that their needs. It's just because of the barriers that in between the healthcare professional and the patient as well.
Okay. We always try and incorporate as much of your client's cultural values, beliefs, practices. We try our best to incorporate that into the health plan, right? To the extent that we are able to. That may look different in the hospital versus the home. What are some barriers to culturally competent care? Providing culturally competent care. There's several culture questions on this exam as well.
Would that have to be like a Muslim patient getting assessed by a male nurse? Could that be it
That's a
too?
good example. That's a great example. What about language barriers? What about literacy barriers? Not
And then-
understanding.
An interpreter or a brochure in the patient's
Mhm.
language.
So culture plays a big role in the way we care for patients, right? I'd like for you to read the beginning of this section on why cultural competence matters. It's on page 120. Okay. There are 10 guidelines, formerly called standards, that have been developed by the American Academy of Nursing. Okay. As we know in community nursing, our nursing care can be going to a client or an individual, a family, a whole community, or the population. Okay, and this is the section I want you to read right here. Okay. These are your 10 guidelines. Oops. There we go. So here's your 10 guidelines to culturally competent care. Okay, these standards of care are based on social justice and human rights. I'm not going to go through them, but you need to know them. Well, actually, we don't need to discuss these one, but let's just go through them because we've been talking about this all term. Knowledge of cultures, right? Education and training in culturally competent care. However that looks, whether it's formal in-service training on different cultures, whether it's education from the patients, the families, whether it's you participating in cultural activities in your community to learn about cultures. And then critical reflection. What's critical reflection? What is that?
Being able to look back after the experience and kind of see how you've done and how you responded to things, and maybe even journaling, talking about your experience and what you learned and misconceptions that you had.
That's awesome. Yeah. I also think about critical reflection is recognizing your own thinking, right? Your own biases, if you have any, your own prejudices, if you have any. Okay, so you're critically reflecting on your own feelings. Another guideline is cross-cultural communication. How do we learn about different cultures? How do we communicate with different cultures? Culturally competent practice. Are we listening to their values, beliefs, practices? What about the overall places we work? Is there cultural competence in your organization? I don't know. Do you have regular trainings and in-services on culturally sensitive care? Another guideline, another guideline that helps us is patient advocacy and empowerment, multicultural workforce, cross-cultural leadership, evidence-based practice. All these 10 guidelines all play a part in being successfully culturally competent to practice. Okay. I want to take a look at our levels of prevention for this topic. Okay, here we talk about hypertension related to cultural differences. Particularly here, we're talking about hypertension, stroke, heart disease. So a primary prevention, and I'm only going through these because there's still a lot of people getting these primary, secondary, tertiary questions incorrect on the exams. So I'm just trying to give us more experience with them. So primary, provide health teaching about a balanced diet and exercise. So we're trying to prevent things. We're trying to prevent things before they happen. Give them some education. Right? Secondary, teach clients and family to monitor their blood pressure, teach about diet, keeping in mind the client's cultural preferences. Okay, tertiary, let's assume they have the high blood pressure and it can't be controlled by diet, right? Maybe we're referring the client to a physician or a nurse practitioner for medication. So they already have high blood pressure. Now we have to help them figure out how to manage it and control it. Does everybody understand why those are primary, secondary, tertiary? Okay, let's jump to chapter 15. Oops. Sorry. Yeah. Why is that not? Hang on. Case management. I'm looking for case management. That is in our, let's see. All right. Okay, that's our chapter 7. Sorry. I don't know why 7. Case management. What do we want to know about case? What is case management? Well, I'm trying to find this. What is case management?
Coordinating care and getting patient services that they may need.
Why? Tell me about why case management plays such an important role in nursing.
Because they help to prevent risks from happening.
Okay.
Help patients with resources post-hospital care.
Okay.
It's for like doing the cost-effective and customized solutions for the patient.
Okay. Okay. So what do you think a case manager might do? What do you think their scope of practice is? What do you think their role is?
Coordinating care.
Coordinating care. So let's say you're a discharge case manager and you work on the cardiac unit and you're responsible for transitioning your cardiac patient that just had a, say, open heart surgery to home. What kinds of things are you going to be doing? And who are you going to be talking to? You're the coordinator of care. What kinds of things you're going to be doing?
Setting them up with home health care, cardiac rehab, and making them follow-up appointments.
Yeah.
They work a lot with the insurance companies as well for patients to get placement and services. Um, most patients don't know how to deal with insurance companies, so case management comes in and plays a huge role with that.
Yep. Okay. I'm gonna go to the study guide here. There's a couple of things in this chapter that, so I want you to have a look at table 15.1. Okay, 15.1 is your nursing process with regards to case management. Remember, I told you we have to think about, still have to think about ADPI in the different topics we're covering. So here's your ADPI with regards to case management. So for example, an assessment, case finding, identification of incentives and barriers for a target population, screening, selection, and intake, determination of eligibility, well, that's where the insurance comes in, assessment of challenges, opportunities, and problems. Okay, and then look at the activities. This column over here, the activities are what a case manager is going to do. What do they need? Do they need resources in the community? Do they need referrals? Do they need written information? Okay, so I really want you to have a look at this because there are questions that refer to ADPI with case management. Okay, and I don't know if you've had a look at this yet, but you need to review it. You also need to review box 15.2. We've talked a little bit about it, but what are some of the case manager roles? Look at all the different roles that they can practice in. Client advocate is a big one. Coordinator, that's another big one. Client advocate, coordinator, educator, liaison. That's what a case manager is. She's a liaison, communication between whatever is needed for discharge. Medical equipment company, Meals on Wheels. Okay, so have a look at the case manager roles. In your study guide, the case management section talks about advocacy. Case manager is responsible in promoting self-determination when advocating for a client. Okay, so advocacy is a big part of case management, right? Nursing case managers work to meet the health and well-being of the clients through coordination of care. So we may be working with physical therapists, occupational therapists, dietitians, resources in the community. Okay. I think that's it for case management. I want to cover a little bit on chapter 16, which is disaster management. Again, there's several questions on the exam about disaster management. And I have a case study that I want to get to. What do you think the nurse's role is in disaster management? It's a big role. What do you guys think it is? What are the phases of a disaster? If you're working in community nursing, you're going to be intimately involved in disaster management. What is it?
Ultimately, you're the healthcare provider.
Pardon me?
Ultimately, the nurses it's going to be their ultimate role is the healthcare provider in rendering care.
Nurses are involved in the preparedness of a disaster, right? The response to a disaster, the after effects of a disaster. Nurses are expected to participate in any phase of the disaster. Two types of disasters. What are they?
Natural and
Man-made, sorry.
That's okay. What's a natural disaster? Give me some examples of a natural disaster.
a hurricane, tornado.
Mhm. It's right on the screen for you, page 288. Have a look at this list, types of disasters. It's giving you natural and man-made. So you said hurricanes, tornadoes, hailstorms, blizzards. What about man-made, human-made? Terrorist attacks,
Pollution, fires.
fires, pollution, cyber attacks, airplane crashes,
Train derailment.
train derailment. Okay, so you have to be able to identify the difference between a natural and a man-made disaster. Okay. In this particular chapter, please have a look at your Healthy People 2030 objectives. Okay, this is on your study guide. Okay, you're going to get asked about what the objectives are. So you need to be familiar with these three. Increase the proportion of adults who know how to evacuate in case of a hurricane, flood, wildfire. Increase the proportion of people who know what the emergency evacuation plan is at their kids' school. I can't think of anything worse than having some kind of a disaster or emergency at your kid's school and you don't know what their plan is. Where are you going to meet them? How do you find out what's going on? And then the third and really important goal is to increase the proportion of adults who prepare for a disease outbreak after getting preparedness information. So if you are helping families prepare, have a look at this box, how to be Red Cross ready. You're going to get asked about that, how to be Red Cross ready. Okay, and more importantly, how do you help families put together a kit? What has to be in the kit? This is also in your study guide. Okay, you need to store at least 3 days of non-perishable food. You need to review the kit every 6 months. Really important, ensure all members of the family know how to turn off utilities and know where the kit is located. Okay. Then here's a nice little list for us. What nurses need to add to their Be Ready emergency kit. Okay. What's the purpose of a mass casualty exercise?
To help with preparedness. Like I remember being in like elementary school and we had fire drills where we just practice, you know, what to do in case of a fire, or even when we had the like tornado drills as well, where they brought us all out of the class. We had to sit in the hall on the floor and not near any doors with our heads inside our knees.
Okay.
To evaluate the agency's response. That's what.
Yeah, the whole purpose of mass casualty and evacuation and fire drills is to evaluate the response. How well are you prepared? Some communities are very well prepared, other communities are not. That's why you do these ongoing drills to make sure you are prepared. Okay, the one federal agency that is going to respond in a disaster is called the NRF, the National Response Framework. Okay, they're listed here on page 296. Okay, and they do provide specific needs to the community. This is in your study guide, and you need to know this. The things that they provide, the services they provide, transportation, safety, transportation, temporary housing, medical resources, search and rescue, and firefighting. Okay, so that is in here, right here. So please know about the NRF. Okay? Right here. That's what I just read right here. Okay? So you got to know what the function is of the NRF. And then we also know that FEMA responds, right? Everybody's heard of FEMA, right? That's all I need you to know about disaster management. And then surveillance and outbreak. What do we want to know about surveillance and outbreak? What do you guys know about surveillance and outbreak? What is it?
Like what was done for the tracing for COVID, and when it came out and it was relatively new,
Mm-hmm.
and we didn't know anything about it, so we were surveillancing for where they came from, what was the cause, who was it affecting.
Mm-hmm. Mm-hmm. In this chapter, you have to know the difference between two different words, observation and surveillance. Do you guys know what the difference in those two are? Okay, so we know that together, observation and surveillance is the process of ongoing data collection, analysis, interpretation, dissemination of health information to monitor disease trends, and then evaluation. What does that sound like? That sound like your AdPi? So now we're applying your AdPi to surveillance outbreaks. Okay, so specifically, observation is to assess the public health status, identify trends of disease patterns, set priorities to be able to utilize your resources, and then develop your rapid response to whatever your outbreak is. Where surveillance, we surveil to reduce morbidity and mortality by preventing or controlling the spread of the disease. Okay, so please understand the difference between surveillance and observation. There's also some surveillance systems that you need to be familiar with. I'm not sure where they are in the book, but let's see. Here you are right here, surveillance systems, page 312. Right, we know that these surveillance systems are essential to protecting the public, right? Surveillance systems assist with early detection, implementing interventions to reduce morbidity and mortality. So we have a couple of kinds of systems, a passive system. Okay, that requires healthcare providers, like where you work, to report something to the health department. So I'll use my school nurse role. Whenever we had a case that was reportable to the health department, we would have to call them. So if we had a case of pertussis, had a case of chickenpox, we would have to report to them. Okay, that's passive. Okay, your information's forwarded to the health department. So that could be a doctor's office, a school, an urgent care, a hospital. Okay, and then active surveillance is when the health department then picks up that information and they start to search for other cases. So think of food poisoning. Say a hospital's reported 10 cases of GI stuff going on, and they all seem to have the common denominator. They ate at so-and-so restaurant. Okay, so that's been reported to the health department. Well, now the health department has to actively surveil other cases or other hospitals having clients show up with those symptoms. Remember your discussion question of surveillance, outbreak and surveillance? Okay. So there's an active system, a passive system, and then there's two more kinds of surveillance systems that I want you to have a look at. The sentinel system and the special system, which is also called syndromic. You guys can look that up. But the two most common are active and passive. And then we also have patterns of occurrence that have to do with observation and surveillance. What are patterns of occurrence? How did it occur? Did everybody get sick at the same time? Did some people get sick after one another or over the course of the week? Okay, so we have to look at what was the pattern. There's several different patterns. Point source outbreak. That's when everybody's exposed at the same time and everybody gets sick. So the example I use is some kind of a chemical in a train. Everybody's exposed, everybody gets sick. You're going to be given some scenarios in your exam where you need to identify what pattern of occurrence this is, or which surveillance system this is. Okay, so point source, everybody gets sick at the same time. And then you also have an intermittent outbreak. Okay, it's an exposure over a period of time with people getting sick at different times. Think about food poisoning. I don't know, let's say you are using guacamole or something, and it was served over a day or so, or 2 days. People may get sick at different times. Everybody doesn't get sick right away. That's intermittent. And then you have a mixed outbreak, and you have a propagated outbreak. So you need to know the difference of the four of them. It's in your study guide. In order to be able to start the process of surveillance, what do you think we need to do first? What do we have to do first in the nursing process? What's our A?
Assess.
Assess. All right, so what are we assessing for when we're looking at outbreaks? Okay, we're looking at specifically with regards to outbreaks, it's called a needs assessment. Okay, so your A in ADPI is a needs assessment for outbreak. And there's different stages. There's a pre-active stage, a reactive stage, an inactive stage, and an interactive stage. Okay? So you need to be familiar with those. So in the surveillance chapter, it's a lot of definitions. So the three things you need to know. What are the systems? Okay, passive, active, the four systems. What are the four different patterns of occurrence? Point source, intermittent, okay? Got to know your patterns of occurrence. And then when we're doing our initial needs assessment, you have to know about the different stages, the pre-active, the reactive. It's 4 different stages. So there's 3 sections of surveillance you need to know. Most of them are definitions, but you have to be able to read a scenario and apply those to practice. Okay? Oops. And then the next chapter, 18, is program management. This is the last chapter I'm going to cover, and then you can update yourselves on chapters 19 and 27 because I do want to do a couple of case studies. And most of the questions on the exam are in chapters 6, 7, 15, 16, 17, and 18. There's not a lot covered on 19 and 27, but you still need to be familiar with the information. So let's
Can you repeat that? I'm sorry. Can you repeat that? Which chapters?
So we have 8 chapters to cover today. The first 6 are in the exam. Okay, chapters 6 through 19 in the, 18 in the exam. It's not a whole lot, and chapters 19 and 27, but you still need to be familiar with it. That's why I'm going to stop here at program management, chapter 18, because I want to go through a couple of case studies, and one of them is case study in program management. Okay, so what do we think about when we think of what is program management?
It's how you assess a program.
Okay. What's the first thing you need to do before you put together a program? What do you need to establish?
Assess the need.
Before that,
The problem.
before that, you have to have a population, certain population, right? You have to determine the population the education is meant for, right? And then you can start going through the rest of your ADPI. But first you have to determine what the population is. If you don't have a population, then how are you going to know what to plan for? Whether the population is a bunch of kids in school, whether the population is the elderly, population is a group of diabetic clients that come to the rec center. Okay, so once you establish your population, then you identify the issues that require education. Then you have to select your learning theory as a framework, and then choose your teaching strategies. That's program development. Population, issue that requires education, your learning theory, and then your teaching strategies. That's what chapter 18 is about, program development. Those are the 4 stages of it. Learning is examined through 3 different domains. How do we learn? What are the domains of learning? Did you guys read this in your prep? Three stages of learning of cognitive, affective, and psychomotor. Okay. Cognitive is your thinking. Affective is your feeling. Psychomotor is your doing. It's in here. It's in this chapter. Let's find it for you. You got to know these. You're going to be given clinical scenarios. Is this a cognitive approach? Is this an affective approach? Is this a psychomotor approach? This is a good box to review. Table 18.1, comparison of the nursing process and program planning. So this is showing you how to apply your nursing process into program planning. Okay. On the left side, it's your ADPI. On the right side, you apply your ADPI to program planning. Okay, there's 3 public health program planning models. Okay, this is in your study guide. This is box 18.3. You have to please be able to distinguish between them. You have a patch model, an APEXPH model, and your MAP model, right? Your patch model is basically pulling in the community for help, mobilize the community to act. Okay, your second one, it's assessing your internal organizational capacity. Okay, so that is more an organizational model. And then you have your MAP, okay, which is mobilizing for action through planning and partnership. Okay, so that's where you're using your community as well. And it's more long-term planning. Okay, so please be familiar with box 18.3. I'm trying to find your cognitive, affective, and psychomotor. Here's your healthy people 2030 goals and your levels of prevention on page 325. Well, let's go back up to our I'm not seeing it in our key terms. Okay, has anybody heard of cognitive, affective, and psychomotor as your learning domains? Have
It's
you
on
used
page
those?
4 of your study guide.
Yes, I'm looking at it, but I'm wondering if anybody's heard about that.
Yeah.
Have you guys
talked
heard about that
it.
in your other classes?
Yeah, and I believe we talked about it a few weeks ago. It was in another chapter.
Okay. Okay. Teach back method. What's a teach back method?
When the patient teaches back to you a treatment option, a treatment plan, or medication regimen, or physical therapy that they would have to do.
What if you try and teach them how to use a glucometer for their diabetes control? What do you want to have them do?
Get the reading correctly and prick their finger correctly and do all of that stuff correctly.
Okay.
But to show you that they know how to do it.
Okay. How do you teach, how would you plan a program for a group of college age kids versus somebody my age? What kinds of things do you have to consider in program planning?
What's relevant to that age group?
Okay.
Like college kids, maybe social media would be like
Okay.
a big platform to help educate them.
Okay.
The time that the patient may have during the day if they're a busy person, and how to help them find time during the day to do these things, how to make it easier for them so they could actually get to it.
Okay. The last bullet in your study guide under program development talks about adult learners having different preferred methods of learning. Okay. Based on their generational characteristics. Okay, it talks about Generation X, the internet generation, and the baby boomers. And it gives you a couple of examples how each of those groups like to learn. So please make sure you review that. Okay. Okay, anybody have any questions? That's a lot of content, but let's do a case study. Okay, I'm going to pull this case study up for you. I have 3 case studies here. The first one is ethics, the second one is disaster management, and the third one is program management. Let's do the ethics case study. Okay, so let's start by could you guys see this? What you got? Yes or no? Okay, this is an ethics case study, so I would like for you to read that. Take a few minutes and read this, please. Oops, sorry. Just give me a heads up when you're done reading it. You guys read through it? Okay, this is a situation in the community that you may very much walk into. As tough as it is. Okay, so let's look at the first question. Is everybody finished reading it?
Yes.
Look at the first question. What do you think the answer is?
I would pick A, the infant's welfare.
Others?
C.
B? Okay. What do you guys think? Well, A is the correct answer. Why is A the correct answer?
The child's safety in that situation.
Right. So thinking through this, sometimes your right to privacy and confidentiality is taken over by the by the potential of injury. Right? So sometimes there are exceptions that need to be justified, right? There may be harm to this baby, right? Does anybody want to add to that? Right? So in this situation, you have a duty to protect the infant's welfare. Why is that? What do we know from this case study?
Have a history of drug abuse. She's already lost 2 kids. Not saying that she necessarily wants to lose that one, but I mean, there's a history, so you definitely want to be cautious.
The baby doesn't have a stable environment and he's under malnutrition and he's not meeting his milestones.
Can't make his own decisions for him, can he? Mom's not being treated for a mental illness, right? So in this case, you have a duty to protect the baby. So yes, confidentiality is certainly important, right? But what if it's at the risk of harming individuals? Does that make sense? Question number 2. Everybody's so quiet. There's only a few people participating. The principle of autonomy is not applicable here because what's autonomy?
Freedom,
Privacy.
independence.
Making his own decision, making their own decisions, right? So why is the principle of autonomy not applicable here?
Because of the child and their age.
Yes. And what else? There's 2 right answers here.
I would say A and B.
Okay. Which sends you
So-
to which sends you to D.
So that's gonna be D.
Right. Right? Tommy's not able to make his own decisions. And now we know his mom's mental illness is not being treated. Does that make sense? So respecting autonomy requires healthcare providers to understand the client's ability to decide and act with his or her own plan. Okay, and we talked about this. The definition of autonomy is the client has the ability to make rational decisions. He's an infant, he can't. He needs an adult to make decisions for him. But her mental illness is untreated. So that's going to be impacting her making rational decisions. Right? Does everybody understand that? Everybody okay? Hearing a funny noise. Okay, the principle of utility when applied to this situation would involve what? And let me preface that by saying the principle of utility allows us to calculate the righteousness or the wrongness of each individual action. So when you apply that, the rightness or the wrongness, what's the right answer?
I'm saying A because it's good versus bad, and A is the benefits versus harm.
What do others think? Do we agree with that A is the right answer?
Agreed.
I agree.
Okay. You're right, because considering the potential benefits and harms of informing child protective services, the nurse needs to decide what is the right or the wrong. If you contact them, there may be some intervention. If you don't contact them, there may be some very negative fallout for the baby. Right? Obviously, why is D incorrect?
The mother may panic and leave with the child.
Try to flee the state.
Why is B wrong?
Because it doesn't matter in the situation with the baby that young.
Exactly. Exactly. Read through these. This is a disaster case study. Why don't you read through this? Okay, have you read through it? Let's go through question 1. You can tell by the answers, just so you know, these are the 4 stages of a disaster: prevention, preparedness, response, and recovery. Those are the 4 stages. So in which stage of the disaster management is performing a mock disaster simulation?
Is
B.
it B? Yeah.
B.
Okay. Right? What would they do in the event of a real emergency? How prepared are they for a real disaster? What do you think the prevention stage looks like? What do you think, what activities do you think happen in a prevention stage? Think of primary prevention. It's focused on reducing risks, right, before they occur. So the correct answer is preparedness. So this mock drill is helping the community prepare. Number 2, you're a nurse called to the scene of the mock disaster. You have to triage the following clients you come upon. How are you going to triage A?
Stabilize the broken wrist. Maybe with a splint.
Right? Let me ask a question first. Which of these three, let's say you're triaging, which of these three is the most severe that you need to deal with immediately?
C, the child.
C.
Yeah, see.
Why is
C.
that?
Risk for
Yes,
dehydration, hypovolemic shock.
Mhm,
40% of his body's burned, so
mhm.
that's
It
Okay.
doesn't say where on the body he's burned either, so it could be airway.
correct.
The highest priority is always given to the victims with life-threatening injuries. Do you agree with that? Who's the second?
I would see the 60-year-old man second.
Why?
He has a history
History
of
of
heart
heart-
disease.
Okay. And what else about the 60-year-old man? The history of heart disease
His
could create
age.
what kinds of exactly. Exactly. Okay. And who would be not the last, that they're not important, but the last priority is given to those victims with local injuries that don't need immediate help. Does that make sense? So this question is prioritizing your triage. What about number 3? This was in your reading. What's the role of FEMA?
Response to disasters, natural
Oh.
disasters.
Yeah, they not only they are part of preparedness, response, and recovery. Okay. Red Cross is part of FEMA. Okay. Community organizations that are providing shelter, food. You know, when you have gyms open up or facilities open up during disasters, that's all part of the FEMA planning. Let's do one more. I want to do one more case study. I actually like this case study. It's on program management that we talked about. Okay, so have a look at this case study right here. Okay, what's the answer to question 1? Remember, we're talking about program planning.
I would say A, formulate a plan, because
Okay.
she already ID'd the problem.
Excellent. Okay. And what's wrong with the other? Why aren't the other 3? Formulate a plan is the correct answer. What's wrong with the other 3? Not what's wrong with them, but where do they come in the process?
B already happened,
Mm-hmm.
and then C and D we can't do until A happens.
Exactly. Exactly. Does everybody understand that? Excellent. Excellent. First, yeah, think of your ADPI. Think nursing process. Okay, what about number 2?
C,
Yeah, what did she do?
surveys.
She did a survey. What's some benefits of a survey?
To collect all the information.
And you get direct information from the people that you're sending it to, right? It's direct and accurate data on a client population and their problems. Right? One of the disadvantages is you might not get the kind of response that you want, but she got 40%. So that's good. What are the benefits to doing maybe a community forum? I'm looking at answer A. C was the correct answer, but what's the benefits of a community forum?
Getting direct input from the community.
In person, hearing from the community directly. And then let's just talk about the last question. So the last question is about implementation and follow-up and evaluation. If you were the program director and you were planning this, what would you do? What would your follow-up be? What kinds of things would you do? Any thoughts?
Can you scroll up to the case again?
My goal would be for each person to include fruits and vegetables with each meal.
Yep.
And then the evaluation, which is, in the next few weeks, asking the patients what they've been eating to see if it's changed.
Maybe send out pamphlets or emails from the website on healthy foods, nutritional eating, or healthy eating. Maybe do some.
Find out where they're going to lunch and maybe include like healthy
exactly.
options.
Yeah. Because remember, she's an occupational nurse. What's her responsibility as an occupational nurse? Her responsibility is to try and keep employees healthy so they stay at work, right? And they're not out with illness-related injuries or issues, right? So
I'm surprised she didn't choose the smoking cessation as a main goal.
Exactly. But that could be part of her plan, offering smoking cessation programs, seeing who followed up on it and tried it, maybe checking with them in 6 months to see how they're doing. Right?
What about snacks like in a break room? Like I'm at work and I don't have time to leave and I want to go look at the vending machine. So maybe healthier snacks in a vending machine.
There you go. Exactly. Again, you're the community health nurse. You're the occupational health nurse. There's really no absolute right and wrong answer. It's whatever resources you have to educate that community, that work environment. Right? So it's pretty subjective. Okay. We covered a lot today. I know it was a lot of information, but I would I would go back, now that you have the rest of the content, I would go back to your study guides. All the information on the study guide should be familiar to you. At least the topics, concepts have been presented. And as I've said for the last 2 exams, every topic, concept may not have been covered from A to Z. So you have to do your due diligence. If there are areas in the study guide that you don't understand or you don't remember, or she didn't explain it well enough, you're going to have to go back and do your own reading in those chapters. Okay? I can't possibly cover everything. I try and cover as much as I can. Okay? Does that make sense? Okay. That's all I have for today. Is that enough? That's a lot. I'll stay on if anybody has any questions. So the next time I see you guys, unless we have a session scheduled, is I'll see you before the exam next Wednesday. If anybody gets caught up early next week, Monday or Tuesday, with not understanding parts of the study guide or not understanding certain concepts, please reach out to me early next week. All right. And we can set up a tutoring, we can set up a quick review session to go over whatever you don't understand. Okay.
I saw that Miss Ford already did her exam review. Will that
Okay.
be posted? It's
Yeah.
because she did hers on the 27th.
Okay. Yep. I don't have that recording yet. So as soon, I think I said that at the beginning of class. I think there's been one done so far. I
Okay.
don't have her recording. So as soon as I get her recording, I will send it to you guys.
She did a lot of test taking strategies on the last exam that was helpful for anyone who needed
Oh.
that.
On exam 3?
Her review for exam 2, she did a lot of test taking
okay.
strategies. So I'm
Okay.
hoping she did it for this exam too.
Okay, great. Great. Okay. All right. Well, you guys have a good rest of the week and we'll talk later. Okay. I'll stay on for if anybody has
you.
any questions.
Thank you.
Have a good rest of the
Thank
week.
you.
You're welcome.